Hello, welcome to Telenursing EU project. I will be your virtual tutor. Let's explore Module 4 about managing acute clinical conditions through telecare. Let's see the objectives of Module 4. 1. Emergency telecare. 2. Allergies anaphylaxis. 3. Mental health conditions. The first sector of lesson telecare in providing aid for emergency incidents. Telecare provides immediate assistance in urgent incidents that require immediate attention or help through the transmission of images, videos, vital signs, and assessments, either by specialist doctors, nurses, or by relatives or caregivers. Specifically, in rural areas where the nearest emergency or trauma center may be several kilometers away, telecommunication can make a difference for an injured or sick victim when ambulances or helicopters take a considerable amount of time to arrive. Assessment of the situation. Who is having the emergency situation? Whom is the nurse speaking to? If not with the victim directly, with whom and why? What exactly happened? What are the complete and specific details? What is the urgency and the emergency need of the problem? What are the priorities? What are the communication-related needs and deficiencies for care planning? When did the situation or problem first occur? Has it been a long-standing issue? Have they sought help previously? When? What previous measures were taken? Has the problem worsened for an extended period? How? How did the problem arise? What contributing factors are involved? Abuse, substance misuse, mental state, lack of healthcare knowledge. Why? Are they seeking help or just simple advice? Are there hidden real needs, and if so, why? Let's discover special cases. Fever, emesis, abdominal pain, dyspnea, chest pain, diarrhea. Sector 2 refers to allergies and anaphylaxis. Let's see the general aim. According to recent publications from the European Academy of Allergy and Clinical Immunology (EACI) and the American Academy of Allergy, Asthma, and Immunology, mHealth can be useful in providing high-quality medical care to patients with various allergies, especially those with allergic rhinitis (AR) and asthma. Nurses can use apps for tracking symptoms of patients with dermatological allergic diseases such as atopic dermatitis, contact dermatitis, chronic urticaria. Anaphylaxis is a severe and potentially life-threatening reaction to a trigger such as an allergy. Anaphylaxis is the result of the immune system, the body's natural defense system, overreacting to a trigger. This is often something you're allergic to, but not always. Let's see common anaphylaxis triggers. Some of examples are foods including nuts, milk, fish, shellfish, eggs, and some fruits. Medicines including some antibiotics. And non-steroidal anti-inflammatory drugs and SAIDs like aspirin, insect stings, particularly wasp. And bee stings, general anesthetic, latex, a type of rubber found in some rubber gloves and condoms in some cases. There's no obvious trigger. This is known as idiopathic anaphylaxis. What are the symptoms of anaphylaxis? An anaphylaxis emergency can occur within minutes to 2 hours of exposure to an allergen. Look for any of the following symptoms during an allergic reaction: swelling of tongue, throat, and/or mouth, difficulty in swallowing or speaking, flushing of the skin, nettle rash or hives anywhere on the body, severe asthma, abdominal pain, nausea and vomiting, difficult or noisy breathing, a sudden feeling of weakness or dizziness from a drop in blood pressure, collapse or loss of consciousness. Continue in how monitoring allergies. Monitoring allergic anaphylaxis through telecare involves the use of remote technology to assess and manage individuals at risk of or experiencing allergic reactions. While telecare cannot replace emergency medical attention, it can provide real-time information and support for individuals with allergies. The basic telecommunication platforms are teleconsultations, symptom reporting, allergy trackers, remote consultations, medication adjustment, digital access, telecare involvement. Let's go to Sector 3 about mental health. See the definitions. Mental health includes emotional, psychological, and social well-being. It affects how people think, feel, and act and helps determine how they handle stress, relate to others, and make choices. Mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses can be associated with distress and/or problems functioning in social, work, or family activities. Mental illness is common. Mental illness is treatable. The vast majority of individuals with mental illness continue to function in their daily lives. Let's see how can a mental health nurse help remotely. The mental health nurse can work with people to plan their recovery, help educate them, their families, and the doctor about their mental illness and its treatment remotely, support them remotely or in person to talk to their doctor or relatives about mental health, provide counseling and strategies to deal with emotional difficulties and stress, help people deal with their symptoms and any medication they take, help people review their mental health treatment with their doctor, help people access support services from services or housing and community programs. To make sure people get the best treatment, a mental health nurse can also communicate with other health professionals involved in their care, like general practitioner, GP, or psychologist, psychiatrist. Let's see the 9 signs of mental health issues. 1. Feeling anxious or worried. 2. Feeling depressed or unhappy. 3. Emotional outbursts. 4. Sleep problems. 5. Weight or appetite changes. 6. Quiet or withdrawn. 7. Substance abuse. 8. Feeling guilty or worthless. 9. Changes in behavior or feelings. How monitoring mental conditions through telecare. Monitoring mental conditions through telecare involves the use of technology to collect and transmit relevant data about an individual's mental health remotely. This approach can be particularly beneficial for continuous and real-time monitoring. Let's analyze the categories. Data collection. Wearable devices. Individuals may use wearable devices, such as smartwatches or fitness trackers, equipped with sensors to monitor various physiological indicators like heart rate and activity levels. Mobile apps. Specialized applications may be employed to gather self-reported data, mood tracking, medication adherence, and other relevant information directly from the individual. Virtual assessments. Teleconsultations can be utilized for virtual assessments and consultations with mental health professionals. Alerts and notifications. Automated alerts algorithms can be designed to detect significant changes or deviations from baseline data. Automated alerts are then generated to notify healthcare providers, caregivers, or the individuals themselves. Customizable thresholds. Thresholds for various parameters can be set based on an individual's baseline and the specific requirements of their mental health treatment plan. Communication and feedback. Telecommunication. Regular virtual check-ins or therapy sessions can be conducted through video calls, allowing mental health professionals to interact with their clients remotely. Let's do a summary about mental issues. Mental health includes emotional, psychological, and social well-being. It affects how people think, feel, and act, and helps determine how they handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses can be associated with distress and/or problems functioning in social, work, or family activities.